video, I'm going to be talking about medicines that should not be crushed or chewed. 1. Medicines that are designed to release their active pharmaceutical ingredients over a prolonged period of time. If these medicines are crushed or chewed, there's going to be an immediate release of the active pharmaceutical ingredients, leading to a high concentration of the drug in blood and putting whoever is taking it at risk of experiencing the toxic effects of the medicine. These medicines are easily identified because they have suffixes attached to their names. Suffixes like XL, XR, SR, CR, LA, or SA. And they could also have things like slow, continuous release, or prolonged release attached to their names. So if you ever buy a medicine, you should look closely at the pack of the medicine or on the blister pack of the medicine to see if any of these suffixes is there or any of these names are there. And if you see it, then you know that this medicine should be swallowed whole and should not be chewed. Typical examples are diclofenac controlled release and nifedipine XR. 2. Coated medicines. The coating of medicines are there to either protect you from the irritating effects of the medicine, to protect the drug from the acidic environment of the stomach, or to ensure that the drug is carried to a site beyond the stomach where it's to carry out its action. The irritating effects of the drug range from abdominal discomfort to stomach ulceration and to even bleeding. So if you tamper with the coating on these medicines, you can be putting yourself at risk, or you could stop the drug from working the way it's supposed to work. Drugs that fall under this category are called enteric coated or gastro-resistant. And they're also easily identified because you would see EC or EN written on them, or sometimes enteric coated is written out in full. A typical example of this is aspirin EC. Sometimes the coating on the medicine is also there to mask the unpleasant taste or smell. So just imagine chewing a drug like this. If for any reason a drug under this category has to be crushed, then it has to be mixed with a suitable food or drink. Emphasis on suitable because not every food or drink is okay to be taken together with medicine. Medicines like this that are coated because of their taste or their smell are cefuroxime and ciprofloxacin. There are other examples, but these are just the ones I can remember right now. We also have capsules that have liquid content in them. There is no guarantee that if you open up such capsules, that you can get all the liquid out of this. And if you don't get all the liquid out, then you're losing some of the effective dose of the medicine. And that's not what we want. We want the entire dose so that we can get the desired effect. So if you have any capsules with liquid content in it, just like Amatem soft gel, then you should swallow it whole. You shouldn't open it up for any reason. We have some medicines that we're supposed to drop into water and it dissolves completely before we drink it. The water is supposed to help with the rapid disintegration of such tablets or such drugs so that when we take them in, there's also going to be a rapid onset of action. So if you choose such a medicine, that's rapid disintegration that we want, or the desired disintegration might not occur. And so it's also going to affect the rapid onset of action that we're looking forward to. So if you have such a medicine and you're supposed to dissolve it in water first, then you should, so that it can work just the way it's supposed to work. We have some tablets too, or some drugs that are supposed to be placed underneath your tongue or by the cheek pouch. These drugs are designed in such a way that they release their active ingredients directly into the bloodstream. So if you chew them and swallow them, you would be losing a significant amount of the effective dose of the drug. And this isn't what we want. So if you're given a medicine and you're instructed to place it under your tongue or by your cheek pouch, then you should. Don't chew it. There is one that almost all of us are guilty of. And if you haven't done this before, then your self-control is really top notch. So we have lozenges that we're supposed to suck in our mouth and allow to dissolve. But we end up chewing it and swallowing it. A typical example of this is strepsils. So this drug is designed to work in our mouth, or these drugs are designed to work in our mouth and in our throats to help soothe them. But we end up chewing it, not allowing it to have enough contact time with where it's supposed to work. And then we say that it doesn't work. If you suck them and allow them dissolve, it will do the work it's supposed to do. Now, there are some drugs that we're not even supposed to crush at all, or it shouldn't just be tampered with by just anybody. And this is because they're either serious skin irritants, they're carcinogenic, or they could even cause harm to an unborn baby. So if you're not sure of the kind of drug that you're handling, then you want to manipulate it, you should speak to your pharmacist first. When is it okay to crush medicines? If the medicine is designed for immediate release, if it is not coated, if it has no issues with stability, if it doesn't have any taste issues or any issues with the smell of the medicine, then it may be crushed. But if you're not able to identify this easily, then you should definitely talk to your pharmacist to find out if it's okay. I hope you've learned something from this video. Please share with as many people as you can because you would also be helping them. I will be willing to answer any questions you have regarding this topic. Thank you for watching. See you next time. Bye.